Hello, it's Dr. Rhonda Johnson. Today is Friday, February 16th, 2024, and my topic today is long COVID and pregnancy. Well, a group of researchers that were funded by the National Institutes of Health looked at the presence of long COVID in people who had COVID during their pregnancy. They asked the question, what is the prevalence of long COVID after COVID infections during pregnancy? Now, their study participants were in the RECOVER study, which is the National Institutes of Health long COVID longitudinal research study on adults and children. There were 1,500 people who were pregnant and who were enrolled in this study across 41 sites from December 2021 through August 2023. Now, the researchers noted that 61% of these people had infections during the Omicron dominance period, and 51% were fully vaccinated. So do you want to know what they found? Well, here I'll tell you. They found that almost 1 in 10 pregnant patients who contracted COVID infection during their pregnancy had long COVID symptoms 6 months later. The most common symptoms were feeling really tired after being active, feeling very tired in general, and dizziness. Now, risk factors associated with long COVID in this group of pregnant patients was disease severity, having the need for supplemental oxygen. Obesity was a risk factor. A history of depression and anxiety during pregnancy was a risk factor, and what I'll call financial insecurity. They also noted that long COVID was not linked to any one trimester of pregnancy, at least in this study. Now, I'll include the links to the information sources. Most of the information that I shared comes from a CIDRAP news brief published on February 14th and the abstract that was published in the American Journal of Obstetrics and Gynecology supplement in January 2024. Now, I want to just personally remind pregnant people to let your obstetric healthcare provider know of your COVID diagnosis as soon as you discover it, because COVID infection during pregnancy can be linked to higher rates of hospitalization, more severe disease, and preterm birth. Now, Paxlovid has been shown to be safe during pregnancy, so please talk to your healthcare provider to see if you are eligible for Paxlovid treatment. That's my message today. As always, folks, be safe and take care.